India began administering precaution doses to healthcare workers, frontline workers and senior citizens with comorbidities on Monday, amid the surge in COVID-19 cases driven by the Omicron variant. Since the pandemic began, India has recorded 35.7 million cases of COVID-19, the highest in the world after the United States.
India began administering booster doses of COVID-19 vaccine to frontline workers and vulnerable elderly people on Monday, with the fast-spreading Omicron variant fueling an almost 8-fold rise in daily infections since the start of the year. In recent days, hundreds of healthcare and frontline workers, including police, have contracted the virus. Facing this rising third wave of infections, the government sent booster reminders to more than 10 million people who took their second dose of the Covaxin or Covishield shot 9 months ago. Only healthcare personnel, frontline workers and people above 60 years suffering from other health conditions are eligible for what the government calls a precaution dose.
मैं यहाँ पे अपनी थर्ड वैक्सीनेशन की डोज लेने आया हूँ और यहाँ पे जो सिस्टम वगैरह जो उनका है वो बहुत अच्छा है, कोई प्रॉब्लम नहीं हुई, बहुत जल्दी काम हो गया है.
Today and tomorrow we will give the booster dose for all the healthcare workers, including the doctors, paramedical staff, nurses, house surgeons, PGs, security and sanitary patients.
India reported 179,723 new cases on Monday, most of them in the country's biggest cities, Delhi, Mumbai and Kolkata, where Omicron has overtaken Delta as the most prevalent strain of the virus. There were 146 deaths reported on Monday, bringing the total toll to 483,936 since the pandemic first struck India in early 2020. Only the United States and Brazil have recorded more deaths. Tasked with protecting India's nearly 1.4 billion people from the virus, the government has administered 1.5 billion vaccine doses in total. About 67% of the country's 939 million adults have been double vaccinated.